Hello everyone, I'm Dr. Smrithi Nayak. I'm a gynecologist, laparoscopic surgeon and fertility specialist working in Aster RV Hospital, JP Nagar. Today I'll be talking to you about egg freezing. We've heard a lot about egg freezing and it's making its rounds in social media, newspapers, all around. And the reason is that we want women to have the option of choosing when they want to conceive and when they want to have a baby. So what is egg freezing? Egg freezing is a technique in which hormonal injections are given for ovarian stimulation, followed by oocyte retrieval, and these oocytes are then graded and frozen for up to 5 to 10 years. The first reported live birth using a cryopreserved oocyte was way back in 1986. Since then, we've come a long way with the advancement of technology in freezing oocytes. Social freezing is a process in which the oocytes are frozen for the purpose of delaying in the childbearing. Now, why should you freeze your eggs, if you ask me? The reason is that we are all born with a fixed number of eggs. In the female fetus, there are around 20 million eggs. At birth, this comes down to 2 million. And as you approach puberty, there is a loss of around 11,000 eggs every month. So by the time you get your first period, you will have only around 3 lakh to 5 lakh eggs in your ovaries. As you grow older, up to the age of 30, there is a plateauing of the number of eggs. But once you cross 30 years of age, there is a drastic decline in the number of eggs in your ovaries. Once you cross 37 to 40 years, there is a huge decline and the number of eggs comes down to just a few thousand number. The key to your fertility is in the age of your eggs. Did you know that by the age of 30, almost 88% of your eggs are already depleted, and by the age of 40, 97% is depleted? Around 1/3 of women in the age group above 30 suffer from infertility, and that number rises to 2/3 for women above the age of 40. The main indications of fertility preservation are: one is medical indications, where if you have to take gonadotoxic agents for the treatment of diseases like sickle cell anemia, aplastic anemia, or autoimmune diseases, it is better to go ahead and freeze your gametes before you go for the treatment. If you have been diagnosed with any sort of cancer which requires chemotherapy or radiotherapy, again, it is very important to visit a fertility specialist to know your options about embryo freezing or egg freezing before you go ahead for the treatment. The last indication is social freezing. If you have not yet found your partner, or if you have career aspirations, financial instability, or you just don't feel you're ready to have a child, then egg freezing is for you. What is the process of egg freezing? So when you first visit our department, we will assess your ovarian reserve. We will do a few scans and blood tests to understand which protocol is best suited for you. On the second or third day of your periods, we'll be starting with injections, which you have to take daily for up to 10 to 15 days. Once the eggs are ready, a trigger shot is given and the eggs are retrieved as a daycare procedure. The oocyte retrieval is done under short IV sedation or general anesthesia. It takes around 20 to 30 minutes, and post-procedure in 2 to 4 hours, you are discharged and can go home. The eggs that are retrieved are then given to the embryologist for grading, and subsequent freezing is done. So egg freezing is a revolutionary advancement which gives you control over your fertility and family planning. It is affordable and feasible, and you'll have the best outcome if it's done early. Please visit Aster RV Hospital for more information on egg freezing before you start your journey into motherhood. Thank you.